One thing that can happen, especially with OCD, oftentimes obsessions and compulsions are not specifically related to one thing and one thing alone. There's often a heck of a lot of variability within the OCD symptoms, which means if we're able to engage in exposure and response prevention with one major thematic, is it possible that another ritualization or another compulsive pattern of behavior would emerge? Yes, absolutely. That is something that we keep in mind anytime that we're working with people who have OCD, because OCD loves to whack-a-mole. It loves to do this thing and this thing. Well, what about this? And what about this? And really, that's part of our role as OCD clinicians, is to keep in mind what the pattern of behavior. It's a little bit like the stat block of the OCD. It's got certain moves. It's got certain things it's going to do. It's got specific patterns, or it's got general themes of how it's going to try to attack my patient. So keeping those stat blocks in mind of how the OCD is weaponizing and how the OCD is weaponizing and attacking the patient really gives us a good understanding as clinicians about how do we attack it back. One of our big goals is how do we buff up the patients in order to combat the patterns of behavior the OCD is trying to do towards them. So is it common that once you've started changing certain compulsive patterns that others will emerge? Yes. That is part of what we already build into the treatment plan, so we don't have a whack-a-mole, 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 whack-a-mole.